Okay, welcome everybody to this first remote public board that we've been holding. Remind everyone that this is going out live on YouTube. Although we don't normally have any bad language, please don't use any bad language. And please keep yourself on mute and raise your hand electronically, and then unmute yourself to ask a question so that we don't get any interference which might interfere with anybody listening. Okay. Right, so say welcome. I think we'll just have to go around and introduce yourselves for any other public who might be watching. So I'm Richard Cullen, I'm a GP and I'm chair of Rotherham CCG. We'll just go around in the order that I can see you. So Jason.
Hi, I'm Jason Page. I'm a GP. I'm vice chair of the CCG. I lead on governance, finance, children, cancer.
David Clitheroe.
David Clitheroe, GP.
Okay, Sam McEwen.
I'm a GP and vice chair of the GP members committee.
Councillor Roach.
Hi, Councillor David Roach, Cabinet Member for Adult Social Care for Public Health and Chair of the Health and Wellbeing Board.
Sue.
Good afternoon, I'm Sue Caston, I'm the Chief Nurse at the CCG.
Wendy.
Hello there, I'm Wendy Allett, Chief Finance Officer.
Ryan.
Ryan DeCosta, I'm consultant endocrinologist and here a secondary care doctor.
Chris.
Chris Edwards, the accountable officer for the CCG.
Lindsay, do you want to say?
Sorry, you broke up there. Yeah, Lindsay Hill, minute taker for the CCG.
Okay, Janet.
Janet Weekly, lay member, chair of primary care committee.
Ruth.
Ruth Note Brown, assistant chief officer.
Okay, Ian.
Ian Atkinson, deputy chief officer of the CCG.
Okay, John.
I'm John Barber. I'm the lay member for governance.
And Debbie.
Good afternoon, Debbie Twell. I'm lay member for patient and public engagement.
Okay, thank you all. And we have apologies from Jeff Avery. Do we have apologies from public health? Any received apologies from public health?
No.
No. Okay. Right. We are, however, quorate. Are there any declarations of interest for any items on the agenda? Okay. Are there any patient or public questions, Ruth?
No, Chair, there's been no questions.
Okay, thank you. If we move then on to the minutes of our, oh, actually, no, sorry. Thought before we start, and I forgot, I'd just like to thank all the members and people working at the CCG for all the hard effort they've done in the last 3 months. Secondly, I'd like to thank all the frontline workers who have contributed so much over the last 3 months. And just thank the members of the board and the public for their patience with us all as we've changed the whole of the health service around Rotherham. And now we'll go on to the minutes of the commissioning group. So minutes from the 1st of April, the accuracy. We'll address the governance and Ruth will just update us on why we are back in the meeting in public during Chris's Chief Officer's report. So page 1, page 2, 3. Okay, we'll take those as an accurate record. Thank you, Lindsay. Minutes of our extraordinary governing body, and this meeting is to ratify the accounts from last year. So page 1. Page 2, 3, and 4, 5. And Wendy, as our Chief Finance Officer, you were completely happy that everything happened in the right order and is done in the right way?
I am, Chair, yes, thank you.
We have an action log.
Richard,
Sorry,
Richard,
Ryan?
sorry. I was present at that meeting. Sorry, I can't get it to work, but I was present at that meeting on the 17th of June, I believe.
Okay, we'll amend the minutes then, Lindsay, if you could. Okay. We have the action log, which is all green. Does anyone want to raise anything? But all the actions have been completed. Okay. So moving on to Chris, Chief Officer's report.
Thank you, Chair. Just before I start, Ruth, could you just explain to the governing body about why we're back in public and what action we've taken?
Okay, so if you remember back in May when we last met, we suspended the standing orders due to the COVID-19 pandemic and the social distancing arrangements, which included the requirement to hold a governing body in public. However, as we've got more fluent with the use of the virtual platforms and seen how other organisations use these to hold their meetings in public, it was decided that we would use the Zoom platform to hold this meeting this time. And as we do as a CCG, want to get back to holding our meetings in public.
Thanks, Ruth. That's very helpful. Thank you. So just moving on to the Chief Officer's report. So again, you should have the report in front of you. And what I'll do is I'll just go through and flag up the highlights, but please do ask me questions as I go along if you wish. So the first one is just to flag up that as a Health and Wellbeing Board and a Rotherham partnership, we aspire to all organisations to sign up to the Rotherham Social Value Charter. This is something we've done through the Health and Wellbeing Board governance structure, but I just wanted to make sure governing body members were aware that this had done, and just to make sure that if we could just, Lindsay, if we could just note that as an organisation we are signed up to the Rotherham Social Value Charter. The second thing is just to go through and just to update members on our Rotherham COVID command structure. So our ambition is always to maintain our governance as it's a sign of good practice. And when we've discussed it with our auditors, they're very keen that we maintain good governance at all times. What we did is we enhanced our governance structure as opposed to shut anything down. So we've enhanced it by adding a goal command structure and a place goal command structure to deal with the COVID situation. So this is just a summary, just to show members what's happened to enhance our governance during this difficult time. The intention is probably to run this until the government descaled us from a level 4 emergency situation, which public health professionals currently estimate to be the end of July, but obviously we'll take advice on that nearer the time. Any questions on that? So I'll keep moving.
Chris, just remind us what level 4 means in terms of our decision making and who's making the decisions.
So level 4 is a command and control structure where NHS England and NHSI take a command and control over the NHS. So in terms of governance, some of our decision making is taken away from us and we go into that structure.
Okay, thank you.
Okay. Okay, the next is the icon, which is the public health message about the shaken baby syndrome. This is just to update members on this initiative. I haven't anything particularly to flag up apart from just to raise awareness on this. I don't know if Sue Cassian wanted to add anything on this item.
Just to say that it's a really good piece of work to take this forward in all areas. It's really positive public health messages in a simple form.
Okay, thanks, Sue. And also just to flag up, before the COVID situation arose, we were moving to a lot of digital pathways in mental health, primarily to increase access to services, but the digital arrangements actually have enhanced our response to the COVID situation. So what we're looking is to go further in terms of our mental health service, in terms of digital solutions. So this is just to show, to alert your governing body members that we are enhancing and expanding the improved access to psychological therapies digital pathway. Lots of acronyms in the paper, but hopefully they're clearly explained. Ian, is there anything you'd want to add on this pathway?
Nothing specific, because I think for governing body members to know that we are planning our expansion of IAPT as per the national requirements, but also with an opportunity via using the IESO product alongside the pathway of our local commission service to kind of bolster provision, which will hopefully then into the kind of next phase of the pandemic.
And the challenge for us as a governing body going forward will be assessing all these digital solutions we've come up with and see which solutions we lock in and keep going forward when we move to a more normal situation. So actually the early feedback is it's going really well and it's quite well received by patients. And obviously it's a lot easier to deliver in a COVID world in terms of a digital solution. So we'll keep going with that and hopefully our innovations will put us in good stead.
Debbie has a hand up.
Sorry, Debbie.
Sorry, it's just I'm having a bit of a problem with the technology, but don't worry. It was actually, I've got two questions. One, which was the one about the governance, which I couldn't get to come up to alert you. I wanted to ask. Could you just confirm, just going back to that point, where the care homes would sit within that governance structure? Is it the social care part?
Yes.
So their voice is coming up through there?
Yeah, the care home issues were all, well, they were dealt with by the social care cell, but issues which needed to be escalated went to Gold Command. So things like the care home testing, the care home outbreaks quite often ended up being escalated to Gold Command. But
okay,
yeah, the care home cell was where the primary discussion was. Yeah. The social care cell, yeah.
Yeah, thank you. And then the question really, which is about this digital one, I'm just asking this really on behalf of everybody, is the offer for people who can't actually take up a digital platform. So in terms of closing inequality, what are we doing to make sure that the digital platforms, I know you've just sort of said you're going to evaluate, but in terms of current practice at the moment, because most things are digital, what are we doing for those who really can't get access through those digital portals?
To come back on that.
Please, Ian.
Yeah, thanks, Debbie. So in terms of the RDash service, this is not to kind of take over from any service that RDash are currently providing that may be under the social distancing requirement. This is an additionality. So you recall that we used IESO earlier in the year to support with digital cognitive behavioural therapy. We're now bringing in the pathway alongside the RDash service to offer another opportunity for people to access the full play from self-referral through to triage, through to therapy should individuals need it, Debbie. So although impacted by social distancing currently, the RDash IAP service is still available.
Are they doing face-to-face then, Ian, or how are they doing it?
Like most services at the moment, Debbie, for outpatient activity, it is limited in terms of any face-to-face contact. Trialing group work via mechanisms such as Zoom, etc. But across the health system at the moment, that kind of managing the dynamic of due to infection control measures and social distancing, the ability for face-to-face contact to take forward is limited.
You're on mute, Richard.
Yeah, I know. David Roche.
Just to say about care homes, the picture there is exceedingly good in Rotherham. We've had 2 weeks up until recently without any care home deaths. We were down to only one care home out of the 85 with any COVID cases. It has gone up to 3, but basically over 65 residential care homes are where the cases are. We've not had a case in the under 65 care homes for 2 or 3 weeks, and we are getting daily reports from care homes about cases, staffing issues, etc., etc. And we have been working with them to supply PPE, and there is a good supply of PPE. I'm talking about the council now within Rotherham, which we have been working with the care homes for that. So yeah, care homes, it's a good picture within Rotherham, all right? You know, we prefer to have seen no deaths or no cases, but it's a good picture in Rotherham. Okay, Simon?
It's just to say from feedback from patients who dealt with quite a bit with this, a lot of them do understand that there isn't face-to-face, but I think there's a small minority that will still need face-to-face, but many are happy to wait when you speak with them about it. I think there's still the issue about the CBT pathway. A lot of people are waiting for them being COVID, and I think some communication to them might be helpful. That's a key. But I think this sort of digital approach is very helpful, and it probably is the way of the future.
Okay, we lost you halfway through, Simon, but you came back towards the end. So.
Yeah, I was just saying that I think the two issues were The second issue, I think, was the CBT. A lot of people had to be delayed further, and there's already quite a long delay for that. And I think it's just sort of feeding back to patients. They'd heard nothing from Ardash and was sort of saying that they would like more information on that. But I think this sort of approach is the way forward.
Okay, thank you. Chris, do you want to continue?
Okay, is everyone okay? Shall I move on? Just have a quick look. Okay, thank you, everybody. So the next one is we generally don't have an August governing body, but this year, myself and Richard have discussed and we're proposing that we do have an August governing body. It might be a shorter version, but I think because things are moving so fast at the moment, to keep the governing body fully engaged in what's developments, we thought was crucial. So if governing body members are in agreement, then I'm suggesting that we do have maybe a shortened, but do have a governing body meeting in August.
Okay, so anybody object to that?
Okay, I think I've got thumbs up. Okay, thanks everyone. Like I said, we'll be in touch, but obviously just assume it's in the normal slot. So just finish off the report then. The comms update. We've got obviously the COVID-19 update and the advertisers coverage as well, which has been very helpful on the whole as well, helping us get public messaging out. And Rotherham, which is another digital, again, taking the feedback, it's a digital resource available for people to support them with mental health issues and mental health support. What we're finding is these digital solutions are being well used and well received, but I think there is a recognition that we can't have 100% digital solution when we come out of this the other side. So thanks for that feedback, but I think that seems to be very consistent with feedback we're getting from elsewhere as well. Thank you. I'll just stop there, Chair, and take questions.
Yeah. Councillor Roach.
Just to sort of say about the advertiser, some people may have seen the headline 2 weeks ago about the autism report, where the headline was included the words autism sufferers. That headline has caused a lot of problems, including some people with autism and their carers refusing to read the report, thinking that was the tone of the report. It is a very degrading and almost insulting term to use that about autism. The headline was entirely the advertisers. It's not in the report. It wasn't said at the cabinet agreement meeting. We have sent a letter to the advertiser. Hopefully, we'll go in to this week's advertiser, making it clear that we did not say, and obviously as part of the CCG, because they are part of the autism strategy, we did not use that phrase. We would not use that phrase. It's entirely the advertiser. Is it also very quickly worth mentioning, Chris, that this coming Friday, we see the first meeting of the engagement board, which is a Rotherham-wide board, including CCG.
I think you mean the outbreak board, Councillor Roach. Yeah.
Yeah. So I don't know if you want to say something quickly about that as well.
So I can do. Is that okay, Chair? So basically, I don't know if it's come from the Department of Health or anyway, the government's instructed all councils to set up an outbreak board. So the idea is that we keep a close eye on the prevalence of COVID in the Rotherham area, and we have a board which would then assess if any further actions need to be taken or any messaging to public needs to happen. It's going to be chaired by the council leader, Chris Reed, and it will first meet on Friday. Myself and Dr. Cullen will be representing the CCG, so we can feedback as when necessary.
Okay. Janet?
Sorry. It's not a question really, it's just a comment, and it's relating to the Social Value Act. And it's just to say that having been involved in this for more years than I would like to remember, I'm really pleased that it's progressed and it's gone to Health and Wellbeing Board and it's come to the CCG. And I think in the wider system, it's really valuable, and it has huge. The test will be, as always with these things, in the implementation and the monitoring of it. But if we can get it implemented properly, then the impact on that on the wider Rotherham population will be huge. So it's just it's just a comment on that, really.
Okay, thank you, Janet. Ian?
Yeah, thanks, Chair. It was just a note to governing body members. The paper that Councillor Roach is referring to in terms of the all-age autism strategy on the forward plan to come back to governing body next month. So it's gone through council governance and our governance is catching up. So you'll receive it in full as members as a version to consider next month. Okay, thank you.
Okay. To clear it, Ian, is it coming back to public?
Yes, Chair. That's, so we went through, it's going to members committee. So we went through our governance of operational exec and clinical exec in this cycle. It then goes on to members and then into our governance in public domain. That's the plan. Yeah.
Okay, thank you, Ian. Thank you, Chris. Shall we move on then? We've got one strategic update, which is the second phase of the NHS response to COVID-19. I think, Ian, you're just going to introduce this. Oops, still on mute. Oh, we seem to have lost Ian. He's back.
So just having a couple of technical difficulties there. I'll just catch this up if that's okay. Yeah, so sorry about that. Apologies for the pause. Yeah, so this is information that we've had via NHS England. It's you'll see the date. It's been in circulation for quite a while now. But this is the next phase in terms of system reset for the NHS. So we've been working locally as a CCG with partners now to develop our response. Hopefully coming out of some of the challenges we've seen on COVID, taking a range of actions around planning. The letter's quite detailed, as you can see. I'm not going to go through each of the areas, but I could take any feedback or comment from members of the governing body, Chair.
Okay, thank you, Ian. Any questions about this paper or the letter? Sorry. Okay. Thank you for giving us that information, Ian. Should we move then on to item 9, the first of the performance report? So Wendy, finance and contracting.
Thank you, Chair. Sorry, just sorting out my technology. So the report we've got this month is as at month 2. The report is now taking on a new format as a result of the temporary financial regime that we've got in place now. That regime will stay in place until the end of July, possibly as a minimum, or probably as a minimum. And so just as a reminder to governing body, this regime involved, amongst other things, which I know we've discussed previously, effectively replacing the allocation that we had previously been notified of and replacing it with a new nationally assessed allocation, which was based on expenditure as at month 11 in the 1920 financial year. So for this reason, the operating cost statement at section 5, it now monitors our own assessment of actual performance against that new nationally assessed allocation. In summary, what I would say is that at month 2, as you'll see, we're reporting a year-to-date net overspend of 1.25 million. 1.4 million of which is made up of COVID-related expenditure, and there's a slight underspend of 150,000 across all the CCG's other portfolio areas. So the 1.25 is a net position. At the time we wrote this report, well, you'll recall previously I'd advised that nationally the expectation was that CCGs would break even, and that would be achieved via a series of retrospective allocation adjustments. By the time we wrote this report, that allocation adjustment ought to have happened, but it didn't. The timeline had slipped slightly this month. But I'm really happy to report that this morning we were actually given that allocation. So the net overspend of 1.25 million year to date now breaks even, which is entirely what we were expecting. So that's good news for us. And I think we can start to see how within this 4-month period that system may work. If we go to the forecast outturn column, I apologise, it says annual in the column heading. It isn't annual. That is, we're working on a 4-month period at the moment because that being the temporary regime. So as at month 4, you'll see that we're forecasting currently that we would overspend by 3.8 million. But again, 2.8 million of that will be due to COVID-related expenditure, which we might then reasonably expect a chunk of that to get reimbursed. And I just would like to draw your attention to the fact that that forecast is still subject to change, because we are making a number of assumptions within that forecast that need to be clarified. So, for example, the treatment of contingency, and this is covered in the detail of the report for you all, but we are assuming some spend against that. We've since had it clarified that we ought not to do that, so it would reduce the forecast outturn. There are just a number of areas like that, so I'll continue to keep you briefed on that position. But currently, that's the position that we're reporting up nationally. So as I said, the report itself contains quite a lot of detail around each of the individual areas, because of course they've each changed in their own right. So I wasn't proposing to go through that live now, but equally I'm happy to take any questions if anybody does have any. So if it's okay with you, Chair, I'll just pause there and open up to any questions.
Okay, John.
Yeah, Wendy, there was two things really. If now we're in balance at month 2, what does that mean for the position at the end of month 4? Does that mean we expect to be in balance at the end of month 4 as well, rather than being 3.7 million overspent?
Yeah.
And I also didn't really understand the under centrally held budgets. There's a figure of 1,120. 1,120,000. I didn't really know what that expenditure was anyway. So, you know, how will it look at the end of month 4? And why is that 1,120 making a bit of a mess of our finances?
Yeah, I think it would look much more broadly in line, John, if I'm honest with you. If I cover your second question first then, so the central budgets bit is us making some assumption about playing in the contingency, which is in the order of 2.2 million ordinarily. So it's us playing in 4 months of that, and also some other adjustments that in the old world we had expected that we would need to make. These were some transactions with NHS England, and again, we're not quite clear. So we're being prudent at this point in time. I think it's likely that we don't need to be prudent, that we should expect that we would just get actual spend reimbursed. So to answer your question, that would bring our overall forecast down. And the reason for that overall overspend then, the reduced overspend, would be predominantly COVID-related expenditure. In my world, that's reasonable expenditure. And we have seen at month 2 that reasonable expenditure did in fact get reimbursed. So I think it's reasonable to expect that we would then get that reimbursed, and it would bring us broadly back into balance.
Okay, any other questions for Wendy? Okay, do you want to move then on to your section 75 paper, Wendy?
Thanks, Chair. So again, as part of the COVID action that was taken nationally, there was a piece of guidance produced around the out-of-hospital discharges, an action that needed to be taken. As part of that, we need to transfer funds across organisations. So between ourselves and the council, for some relevant spend to out-of-hospital discharges. And the Section 75 is literally just a mechanism by which we can do that. The paper outlines that there were actually 3 potential mechanisms by which we could transfer funds, but the Section 75 is probably the most technically correct, because it could be that the council are actually spending money that has a health impact, and therefore we need a Section 75 to cover us governance-wise. So with that in mind, a number of options were taken to OE, which are also in the paper today for governing body, and we just supported the action to just get on with this and set the Section 75 up. Council colleagues are completely on board with this. The finance department's drafted an agreement between ourselves, and that's now going through the council for full approval. And so it's here for governing body to note and to support that work continuing.
Okay, any questions for Wendy? Okay.
Thank you.
Is the board happy to continue to support the as requested? Yeah. Okay.
Thank you.
Thank you, Wendy. Let's move on then, Ian. Commissioning plan performance report from a time long ago.
Yeah, thank you, Chair. As you say, it feels like a long time ago, doesn't it? Q4 of last financial year. But this is in effect, the last reporting period on our commissioning plan, moving up to the end of March. Members of the governing body will be familiar with the format in terms of us identifying milestone delivery and our RAG rating against those milestones for the full year. I think from my perspective, Chair, just reflecting back on what has been a positive year against delivery against the kind of commissioning plan and the milestones associated with it. We have flagged a number of areas where we were either green, that we've moved to amber in the main, where we've been reviewing pathways of care that have been impacted by COVID-19. You can see those in the area of diabetes and respiratory. And then we've also got a number of areas that have stayed amber in terms of the Q3 to Q4 position. Again, some impacted by the COVID pandemic that came online from March, obviously. And then others, such as the use of the Rotherham Health app, that although are flashing as amber in here, we've seen quite a significant uptake of the Rotherham Health app during the pandemic period. So the time periods kind of moved us on again in terms of our local position as we are now. In terms of next steps with this is probably the last time that governing body will see it in this form as we move into a different way of reporting against priorities going forward. So hopefully it makes sense. It is a positive view for the CCG at closing out 1920s commissioning plan. Happy to take any comments or questions on it, Chair. I'll pause there.
Okay. Any questions for Ian on this paper? Thanks for all the work. It does, but as I said, it does seem a very long time ago, doesn't it? And the world has changed.
It has.
So we haven't got many questions on it. Okay, if there's no questions, we'll move on to then the delivery dashboard here.
Yeah, thank you, Chair. So in terms of the delivery dashboard, again, this is a similar position in terms of our reporting period, because during the pandemic process, a lot of our reporting has either paused due to changes to pathways of care and delivery, but we have kept the same outline approach and framework for reporting for consistency. So I'll just give you some high-level narrative, and I'll also just expand on some of the areas such as A&E numbers and activity, just to give you a bit of a flavour of where we're at as a place at this point in time, which is the most up-to-date position for the Rotherham Borough. So I'd just flag a number of things which are seen in our health economy, but they're also seen in other health economies, not just locally in South Yorkshire, but at a national level. So our A&E numbers, you just to remind colleagues that we were working against a national pilot for A&E reporting. We weren't routinely reporting against 95% target, because we're part of 11 trusts locally, nationally, sorry, that we're trialling a pilot mechanism. That pilot continues. We have seen positive performance against that pilot throughout the pandemic. That's mainly on the back of low numbers coming through the A&E department. And again, just to reflect to colleagues that we, in a routine period with TRFT, we're usually seeing around 300 patients attending per day. In winter, that goes up to 320, 330. At the height of the pandemic, we're in the 190s to 200s. So you can see how the numbers dropped off considerably, which is a national trend. However, we are now starting to see numbers back to what we may see as a norm at this time of year, 270s and 260s through the door in the hospital at the moment over the last few weeks. So getting back to that level of patients presenting, which is a positive for us, because there was some concern around challenges of people not presenting into the hospital system. But that said, we really need to get the balance of the right people attending through A&E going forward. In terms of our flow in hospital throughout the period, although our delayed transfers of care data that's presented in this document only goes up to the April period, because that's the published view, I'll report to governing body that we do have good flow in the hospital setting. we have had good flow throughout in terms of the work that's been undertaken around discharge pathways, so that's positive. Our IAPT view, I know we've mentioned it earlier in the discussion, is that we did see a significant drop off in IAPT referrals through the March and April period, but they are now starting to come back to what we'd see as a normal level in terms of IAPT referrals, which is what are actually feeding through to us, and we'd expect increased capacity to go through there in activity. The diagnostic pathway, which you can see in there, is flashing red throughout. So we've historically performed top 10% in the country of ensuring that we meet the diagnostic needs of patients within the 6-week wait, within the timeline. You can see that that's down at 69% now, which is a reflection not just in Rotherham but other areas where we've just not been able to flow the level of diagnostics due to COVID through the system. And cancer pathways, you can see there in terms of our breach levels, they have increased over the period that we've got available data to report on. The focus now is how we kind of get back on top of our kind of cancer pathways. I know there's a lot of work and scrutiny taking place now around that patient treatment list and how we can flow patients associated with cancer through our services. And I know Jason's been close to a lot of that work. So I hope that just gives you a flavour of where we are with performance. We've not had anything nationally as part of any planning requirements in terms of positions on expectations on return to performance, but again, some real challenges presenting themselves now against national standards as a result of the COVID pandemic.
Okay, thank you. Thank you, Ian. Any questions? Jason?
Not a question, but just a comment really on the cancer situation. So the situation is obviously difficult due to COVID. On the patient tracking list that Ian alluded to, before COVID, that was at around 600 patients. So these are patients who have been referred on a 2-week wait by GPs or as a consultant upgrade and are waiting for a diagnosis to be made, either positive or negative for cancer. And it was at around 600 before COVID, is now at around 1,200 people on that list. And generally we have around 30 to 50 people who've gone beyond the 62-day wait, and currently that's standing at around 250, with a good number of those people waiting due to waits for endoscopies. So, you know, that there is a lot of work to do at getting those cancer services switched back on. It's definitely a challenging time, and I think for the next few months we're going to see difficulties with the figures for cancer while those services gradually get switched back on, mainly for the discussion, for the reasons in the discussion we had earlier.
Thank you, Jason. Any other questions or comments about the performance paper? Okay, thank you. I'll move on then. So a verbal update on safety and quality, and then patient engagement, and Debbie might want to add in anything from her point of view.
Thank you, Chair. Just start off just very briefly with CQC inspections. The RDASH inspection that had taken place, they're developing an action plan in response to the well-led inspection report that was published in February. And as we know, the overall rating of the trust requires improvement, and the action plan details all the must-dos in detail in relation to the inspection recommendation. It's been shared with the CCG, with the CQC, and has been accepted through these routes, and they're progressing the actions against that plan. Just on serious incidents, the challenge with a lot of the quality and patient experience has been finding new and innovative ways to keep abreast of all this work with all the changes in the way that we're working, and follow the guidance from NHS England and improvement. So part of the guidance from NHSEI was around serious incidents, in that they must still be reported, but the timescales for full reports have been suspended for a period, though not for the initial actions. So we have continued with our serious incident committee and taken the initial actions where there's learning that can be taken from a short investigation and that can be shared across the organisation and wider than that. So although the number of incidents that remain open is rising, with us closing very few, that's because we're following the guidance. So we will be playing catch up in terms of the full investigations, but there are also running alongside that, there are moves to review how serious incident reports are performance managed, and whether that will move, I'm not sure. Infection prevention and control, as you can imagine, a lot of the work is centred around COVID. The trick here has been to not take our eye off the ball with regard to all the other work on infection control. This has been a time where we've worked much closer together, both with our providers and with the local authority. So a massive piece of work, as Councillor Roach alluded to, took place with the local authority, working jointly, and the care home liaison team, members of that team from TRFT, working into care homes across the patch, all care homes, to deliver infection control training that covered the use of PPE and swabbing testing as well. And then we've jointly supported the programme for undertaking swabbing of staff and residents in care homes. Looking wider across there, looking at some of the infection prevention control work, we've seen a decrease in the number of C. diff cases in the trust, though some of the community cases that are reportable under the CCG heading have increased. We've also seen a dramatic decrease in E. coli's reported, and some of that work going forwards the focus for that will be the increase on C. diffs, and looking in a bit more detail as to what's happening around the E. coli numbers. Looking at the RDASH, delayed transfer of cares, the mental health and learning disability, the work is ongoing in that area. Two working age delays are current in that category. One patient's awaiting a suitable placement, and that is proving quite complicated, but work is ongoing there. And the other delays due to some issues around needing some adaptation. So these aren't halted, they're being addressed. Both of those areas are being addressed. We still have 3 winterborne patients remaining as inpatients that are reportable under that category, though none of those have been reported to be unwell due to COVID. The care, education, treatment reviews and care and treatment reviews, we've looked at undertaking these via Zoom and Teams. We're doing them virtually, and we've had some success in this area as well. This work needs to carry on, and the learning disability mortality review has been another area that's been challenging. It's just the same as for everybody else with all types of work, but that's continued with support across the system there. I'm looking across at safeguarding. We have made a lot of advice and guidance available, both publicly on our public safeguarding page and staff safeguarding page. So there's lots of updates there. Worried about an adult or child, safeguarding useful contacts, professional eyes and ears forms, parent guardian online radicalisation information. There's a whole raft of information that has been made available on those two by those 2 sites. And the fabulous fortnight took place in June regarding safeguarding training, and all the hours that were undertaken there contribute to any level of safeguarding, achieving your safeguarding training. And going back up, sorry, I've got this all on one report, onto the experience and engagement. This has been a challenging area as well, and I think Debbie will have something to say about that, I'm sure, in terms of keeping the momentum going, keeping some contact going there, and looking into best practice and resources and innovative ways of collecting information and keeping contacts there. So there's been fortnightly updates with engagement practitioners across the whole of South Yorkshire and Bassett Law, looking at emergent issues and other activity going on, learning from each other. The regular webinars through the Consultation Institute, and collating engagement activity, which has proved slightly more challenging for Helen this time, because she hasn't got the benefit of being able to perch on people's desks and nag them till they give her what she wants to make her go away. So she's undertaken that, and that activity has been collated. We've taken that through the committee there. Lots of work being pulled together around that. Regular contacts and information sharing with Health Watch been taking place, and contact with Age UK. There's a whole raft of organisations and groups that Helen is maintaining contact with, and there has been a virtual patient participation network group, hasn't there, Debbie? And I'll pass over to Debbie at this point.
Yeah, thanks, Sue. I think, first of all, I'd just like to say thank you to Helen and to Gordon, really, because they have taken the front, really in the front of making sure that patients have got access in and out of us, and we're keeping up those conversations and keeping them flowing. Certainly, we've worked and taken a lot of cognizance from the work that Health Watch have done across the country and also locally. They've been doing survey after survey, and that information is coming back into the CCG, which has been invaluable in terms of what's happening. They've highlighted in the early days that there was almost too much information out there for the general public. This is what the public were telling us, and it was a bit confusing, especially around shielding. We also really had our PPG first foray into virtual world, and we did a coffee and a chat morning about 2 weeks ago, and it was just completely open. We had no idea how many people would join us, but we had a fair few of quite a lot of hard to hear communities as well as PPG members, and it was a really interesting morning, and we were able to share their experiences, and they were able to share with us things that perhaps weren't working as well. For some of them, it was their very first time actually using Zoom or Teams. We did it on Zoom, and we put out lots of help and information before that meeting, which was really encouraging, that they were felt it was important to join us enough that they would actually go through that awful getting hold of technology and can they get it to work, and they did very successfully, which was great. One of the things that they did share with us is that whilst they've been in lockdown, although it's been long and it's been difficult, and they are worried about not meeting family members and everything else about society, but many of them, and I know we hear this nationally, many of them are fearful of now what's next and getting back out in there and doing the normal things. And that's something I think we'll have to, as a CCG, be mindful of, is how we support everybody going back into the reset and refresh of the NHS and the new way that you access those health and get people in there, whilst also addressing this idea of health inequalities and digital platforms and all the things that are now coming out of the data that we've got about what's actually happened to people like the Black and ethnic minority communities, etc., and getting hold of those. So Helen has taken lots and lots of direct, she said to me the other day, she said, all I've done is, she said, I've found the right language for people and pointed them to the right information, because there's been so much information out there in so many different formats that it is quite confusing. So I think she's done a sterling piece of work, as has Gordon. Sorry, I don't want to decry what he's been doing as well in terms of communication from the CCG.
Can I add just one more thing, please, Chair? On top of that, Helen's also compiling and collating a list of areas where we may need to review and readdress engagement and consultation post-COVID, and that's in response to guidance that we've received from NHS EI.
So could I just ask, you may not know the answer to this, I know they suspended Friends and Family Trust gathering of data, didn't they? do we know what partners are doing in terms of trying to open up that voice about experience to do with Yorkshire Ambulance Service, TRFT, all those other partners that we work with? Is there an alternative, or have they come up with a different alternative, or we're just going to have a big hole of 3 months not really having? I mean, I know Clap for Carers has kind of told everybody how much value and worth the NHS is, but I'm just wondering whether there is an alternative. Do you know of?
I don't know of that, but what I would say is that friends and family is just a pure collation of numbers for the most part, and doesn't have the meaningful work that allows you to do some work locally. That work locally continues regardless. They're just pure collation of numbers that people fill in a form, and there's no narrative on most of it. It isn't taking place via the national platform, but that hasn't stopped the local work.
Yeah, I agree with that. Okay, thanks.
Okay, any questions for Sue or Debbie? Councillor Roach. Oh, you're still on mute.
You might want to take yourself off mute.
Sorry about that. I thought this was all automatic and Richard was doing. Never mind. Anyway, 2 comments and 1 question. First of all, I'd just like to back up what Sue said, that both CCG, the hospital, and the council are working very well together with care homes, and we are getting a lot more information from them. The partnerships are a lot better. But also a word of caution in that we know that the average vacancy rate at the moment in care homes across most of South Yorkshire is 25%. That's partly because of COVID-19 deaths. There's also partly because several people are saying, no, I don't want to go into care home during the current crisis. This does create an issue of market sustainability, although we do have a surplus of care home places within Rotherham. And the question, next comment was, members may be aware, but may not have been fully cognizant of it during the current crisis, that in April, the Health Works contract passed to Citizens Advice Bureau from the former provider. And my question is, Sue, you referred to detox figures. Before COVID-19, if our detox figures went above a certain level, we would have some of our better care funding stopped or suspended. Is that the case, or has that been relaxed during the current crisis?
I don't know the answer to that. I'll look at Ian and see if it looks like he can answer that one.
I can probably help. Well, detox have been actually at an all-time low during the crisis. They were at 0% for much of the period, Councillor Roach. So performance massively improved in terms of delayed transfers of care from hospital. So it wasn't an issue. I don't think we would have had the money removed in this situation, but it was actually completely the opposite effect.
Okay, thanks.
And the reference to delayed transfer of care I made was purely around the complex mental health cases. I did just want to mention, just again in response to some of the care home stuff, we do have the highest completion of the capacity tracker across South Yorkshire and Bassetlaw. Our care homes are excellent at completing that. It may be something to do with the local authority tying completion of the capacity tracker into another initiative. However, it works.
Okay, any other questions for Sue or Debbie? Okay, thank you very much, Sue and Debbie. And we'll move on then to audits and reports. Chris, the Primary Care Committee annual report.
Nothing particularly to flag up on this. This is coming just in terms of good governance, I think. I don't know if there's anything the lay members would wish to flag up.
Sorry, Chris, I don't think there's anything from the Primary Care Committee. It's an annual report that comes of the work of the committee. It's been to ACCA, it's been to that. It's just coming for information, I think.
Yeah.
Okay. Any questions or comments about the paper? Okay. Moving on then, Ruth, there's a couple of policies here.
Thank you, Chair. The first one, the organisational change, redundancy and pay protection policy. This is a South Yorkshire and Bassetlaw HR policy. So I apologise in advance if you have questions. If I'm not able to answer them, I will take them back and come back to you. This policy has been agreed at the Remuneration Committee in June, and it is here for ratification. Chair, I don't know whether you've got anything more to say for this one.
And I think this is just about us aligning with the other CCGs.
Exactly. So the policies we had across the 5 CCGs in South Yorkshire and Bastley were largely the same, but there were a couple of issues around protection periods, which we made consistent, and we took the approach of being the best employer. So what we did is we moved with the feedback from the unions to move to the most advantageous to staff position in South Yorkshire. So what we did is we came up with a solution that brings us into line with everyone else, but the changes are pretty minimal.
Okay. Just a reminder that there was a lot of typing noise there, so if any people can go back on mute. Any questions or comments? Any comments back from lay members who are at the Remuneration Committee? No. Okay, fine. So we are asked to ratify. What's the wording, Ruth?
Yes, you're asked the governing body to ratify.
We're happy to ratify. I shall take the thumbs up signs and the nods as approval. Getting some thumbs up. I'm looking for. Yeah, that'll do. Wendy, you need to learn how to use the thumbs up. You can't use your own. Okay, thank you. We've ratified that. Thank you very much. Moving on to the next policy then, Ruth.
Thank you, Chair. So many thanks to Alison for pulling this year-end report together. Emergency preparedness is one of those areas that I sometimes think we don't do a lot of work on until you actually sit down and go through the diary to compile a report like this, and then you see how much work you have done on it. This year has been a mixture of governance work in the shape of policy reviews and self-assessments, live incidents, tabletop exercises, and staff training leading to some qualifications. And that leads me on then to the business continuity policy and plan, which has been reviewed. It's an annual review, no major changes to it. It has been to Aqua, and it's here for ratification.
Okay, thank you. Any comments from Aqua, John?
No, Chairman, no comments other than that we'd recommend that the governing body approve the policy as set out by Ruth. We were really content with it. Yeah.
Okay. Any questions or comments for any of the governing body members? Oh, okay. So we note the end of year report, and do we ratify the policy? Everyone happy with that? Yeah. Wendy's found the thumbs up button. Excellent. Okay, thank you.
Thank you, Chair.
Right, and there's just minutes from the Remuneration Committee. I think they're just for information, or do you want to bring anything up, Janet?
No, Chair. It's just for information, and it refers back to the policy that we've just talked about, the management of organisational change, and it's to bring other CCGs in line.
All right. Thank you. Any questions or comments from any board members about that? Okay, that's fine. Right, does anyone want to ask about any future agenda items, raise any future agenda items? Any?
Chair, we'd hope by the national guidance on the next steps for the NHS are expected to be received prior to our next meeting. So hopefully I'll be able to put that on the agenda for next time. Okay.
I've not been notified of any urgent other business, but we do have time if anyone wants to raise anything. Oh, okay. I don't think we've need anything escalating or any risks raised. Okay. In which case we'll move to end this public meeting. And we need to consider the following resolutions: that representatives of the press and other members of the public be excluded from the remainder of this meeting due to the confidential nature of the business to be transacted, publicity on which would be prejudicial to public interest. So that's the end of the public meeting, confidential meeting. I think we will start in 1/4 of an hour. Okay,
do we leave this meeting and join that?
You need to leave this meeting, and it's a separate meeting request. Thanks for anyone who's been listening. Feedback on to the CCG about this or any questions can be done through the generic CCG email address that can be found on the website. Okay, thanks everybody.
Thank you. Bye.
Bye.